Tinnitus is a constant noise or ringing in the ears. It's often tied to hearing loss, which comes with aging or loud noise exposure. This kind of hearing loss is believed to stem from the brain's attempt to offset the decline in hearing sensitivity. In these cases, a hearing aid is a primary treatment. It amplifies the sounds around, masking the tinnitus, making it less intrusive. Sound therapy is another method. It involves a subtle background of music or white noise. This can mask the tinnitus. Learning to live with tinnitus, to accept it, is also vital. Another treatment is acoustic neural stimulation, ANS. It's like an MP3 player, delivering a spectrum of sounds through headphones. It aims to activate different parts of the auditory system, reducing sensitivity. Imagine a symphony orchestra with certain musicians playing too loudly, causing a buzzing or ringing. ANS is the conductor, bringing a varied composition, each instrument playing its part to balance the orchestra. Lifestyle changes can help too. A healthy diet, avoiding caffeine and nicotine, and steering clear of loud noises all play a role. Supplements like Ginkgo biloba, zinc, or magnesium might be beneficial, but research here is limited. Noise-induced tinnitus is another common type. It often manifests as a high-pitched ringing. This kind of damage is mostly permanent, though some cells may only be partially affected. It's prevalent among those frequently exposed to loud noise, like musicians, soldiers, and construction workers. The first step in treating noise-induced tinnitus is preventing further damage by avoiding loud noises. The treatments for noise-induced tinnitus are similar to other forms. While there are no specific medications for this type of tinnitus, antidepressants are often used when the condition significantly lowers the quality of life. Ototoxic medications and tinnitus, ototoxicity, certain medications like aspirin, ibuprofen, and antibiotics such as gentamicin and tebramycin are considered ototoxic. This means they can potentially damage the hair cells in the inner ear, leading to tinnitus. Chronicity: in about 50% of cases where tinnitus is induced by these medications, the condition becomes chronic and persists even after stopping the medication. Recommendation: if tinnitus is noticed after starting a medication, it's generally advised to stop taking that medication and consult a healthcare provider for alternative treatments. This is to prevent further auditory damage. Meniere's disease and tinnitus: nature of the disease. Meniere's disease affects the inner ear, which is responsible for both hearing and balance. This disease leads to the accumulation of fluid in the inner ear, disrupting its normal function. Symptoms: the accumulation of fluid leads to symptoms such as balance problems, vertigo, hearing loss, and tinnitus. The tinnitus in Meniere's disease is due to the involvement of the cochlea, the hearing component of the inner ear. Treatment options: dietary changes. Restricting salt intake can reduce swelling in the body, including the inner ear, and improve symptoms. Medications: diuretics like hydrochlorothiazide or acetazolamide can be effective in managing the condition. Steroid injections: in severe cases, injecting steroids directly into the inner ear can provide relief for some individuals. Surgical interventions: depending on the severity and specifics of the disease, surgical options such as endolymphatic sac decompression, vestibular nerve section, or labyrinthectomy may be considered. Supplements: Ginkgo biloba, magnesium, and vitamin D are sometimes used, though their effectiveness varies and results are mixed. Disease progression: Meniere's disease can progress over time, although it also may have periods of remission. Preventability: currently, Meniere's disease is not considered preventable as its exact cause remains unknown.